Why do 40% of people stop taking Lexapro within the first 30 days? Is it because of the jitteriness, the emotional flatness, the sexual side effects, or the anxiety that gets worse before it gets better? And what happens to people who tolerate the side effects and continue to take this medication? I'm Dr. Eyre, quadruple board certified psychiatrist and anxiety expert. I've treated thousands of people with anxiety, and Lexapro is one of the most common medications I prescribe. So let's talk about what to expect, the timeline, side effects, and how to come off this medication. Lexapro is the brand name for escitalopram. It's an SSRI, a selective serotonin reuptake inhibitor. I'll explain what this means. You see, your brain cells communicate using chemical messengers. Serotonin is one of them. It helps regulate fear, mood, and how your nervous system responds to stress. In an anxious brain, serotonin gets pulled back into the brain cell too fast before it can finish its job. Lexapro slows that process down. It keeps serotonin active in the space between brain cells longer so it can actually do what it's supposed to do. Think of it like a text message that keeps getting deleted before the other person reads it. Lexapro stops the deletion so the message finally gets through. But here's where most people get blindsided. In the first 1 to 2 weeks, many people feel more anxious, not less. Jittery, nauseous, emotionally flat. Some people feel a strange inner restlessness called akathisia, a sensation of needing to move their body. This is not the medication failing. This is your brain recalibrating. Here's why. When serotonin levels rise, a part of your brain called the amygdala, your threat detection center, can temporarily become more reactive. The amygdala is like a car alarm. In an anxious brain, it already goes off too easily. In the first weeks of Lexapro, that alarm can get even more sensitive before it finally resets to a healthier threshold. This is one of the reasons people stop Lexapro too soon. They feel worse and assume the medication is wrong for them, but they're stopping right before the shift happens. I had a patient, a man in his late 40s, high-performing professional who had been white-knuckling anxiety for years. He tried Lexapro twice and stopped both times within 10 days because the jitteriness scared him. When I explained the amygdala recalibration, he looked at me and said, "Why did nobody tell me that before?" He stayed the course on his third attempt. By week 4, he described it as the first time in a decade he could sit in a meeting without his heart racing. When you're on Lexapro, something happens in your body around weeks 3 and 4. The edginess begins to disappear. Racing thoughts slow down. Sleep starts to improve. The tight chest, the shallow breathing, the low-grade dread that follows you everywhere begin to lift. This is your prefrontal cortex coming back online. The prefrontal cortex is the calm, rational part of your brain. It's the part that says, "You're safe. This is manageable." In chronic anxiety, the amygdala drowns it out. Lexapro helps restore that balance by turning down the threat center and turning up the reasoning center. But here's the part most prescribers never explain. The medication is not doing the healing. It is creating the conditions for healing. And what you do inside that window determines how much you actually recover. In a moment, I'll explain exactly what fills that window, because if you just take the pill and wait, you're leaving most of the benefit behind. Something really intriguing is that some studies show that Lexapro increases a brain protein called BDNF, brain-derived neurotrophic factor. Think of BDNF as fertilizer for your brain cells. It helps brain cells grow new connections, repair old ones, and build the kind of flexible, resilient brain circuitry that reduces anxiety over time. This is called neuroplasticity. And Lexapro opens a window for it. But neuroplasticity requires input. The brain rewires based on what you repeatedly experience and practice during that window. If you take Lexapro and continue living in the same high stress, low sleep, no recovery patterns, the brain rewires around those patterns. If you use that window to practice calming the nervous system, improving sleep, reducing inflammatory load, and building moments of genuine safety into your day, the brain rewires around those patterns instead. This is why sleep, is not optional when you're on Lexapro. During deep sleep, your brain consolidates emotional memories, regulates cortisol, and resets the HPA axis, the stress response system that drives so much of chronic anxiety. Poor sleep keeps the HPA axis stuck in threat mode, working directly against what the medication is trying to do. If sleep is still a struggle for you, I put together a free sleep guide specifically for people managing anxiety. It's in the description below. And if you're finding this kind of explanation helpful, subscribe to this channel for new weekly content. So how do you take Lexapro? The dose starts at 5 to 10 milligrams daily. The standard range for anxiety is 10 to 20 milligrams, but the right dose is not the same for everyone. Also, as you get older, hormonal shifts, metabolic changes, and years of accumulated stress all affect how your body processes medication. Some people do better at a lower dose for longer. Some need a gradual increase. Some get the best results by combining a modest dose of Lexapro with non-medication approaches rather than increasing the dose. Now, let's talk about coming off Lexapro. Maybe the medication did its job and your nervous system has stabilized enough to move forward without it. Or maybe it was never the right fit to begin with because it wasn't working or you had side effects. Stopping Lexapro abruptly is one of the most common mistakes I see. When you stop an SSRI too quickly, your brain experiences what's called discontinuation syndrome. This is not addiction. This is not withdrawal in the way people think of it. But it is real and it can be intense. Symptoms include dizziness, brain zaps, which feel like brief electrical pulses in your head, flu-like feelings, irritability, and a sudden return of anxiety that can feel worse than before you started. Here's why this happens. Your brain has spent weeks and months adapting to a certain level of serotonin activity. When you remove the medication suddenly, it's like the system goes into shock. The serotonin receptors that recalibrated upward now have nothing to work with. The solution is a slow, structured taper, especially if you've been on this medication for a long time. I generally cross-taper with a different medication if Lexapro is not working, but in cases where a patient no longer wants to be on a medication and has been taking it for years, the general principle is to taper very slowly. In such cases, I may consider reducing the dose by no more than 10 to 25% at a time, with at least 2 to 4 weeks between reductions. For someone on 10 milligrams, for example, that might mean dropping to 7.5, then 5, then 2.5 over several weeks. It sounds slow, but it is the difference between a smooth transition and weeks of misery. This is even more important for people who have been on Lexapro for a long time. And here's something worth knowing. Some people feel a temporary increase in anxiety during the taper, even when they're doing it correctly. That is not a sign that you need to stay on the medication forever. It is a sign your nervous system needs more time and more support during the transition. Tapering is also the moment when lifestyle medicine matters most. Sleep, nutrition, exercise, and stress regulation are not optional extras during a taper. They are the scaffolding that holds your nervous system steady while the medication is cut back. For some people, Lexapro will not be enough on its own. That's not a failure. Anxiety is not just a serotonin problem. Other contributing factors are brain inflammation, gut dysfunction, hormonal imbalance, mitochondrial stress, and a dysregulated nervous system. If you've been on Lexapro at a therapeutic dose for 8 to 12 weeks and you're still significantly struggling, it may well be that the root cause hasn't been fully addressed yet. If you want to understand what's driving your anxiety beneath the surface, the root causes most doctors never check, watch this next video.